Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Welcome to Business Innovators Radio. I'm your host, Ken Sharman. Today's guest is Dr. Vera Brown, a licensed dentist, TMJ provider, continuing education provider for dentists and hygienists, and serial entrepreneur. Well, these days she's educating dentists on things like TMJ and oral manifestations of disease, but that's not where she started. Let's jump in and talk to Dr. Vera Brown about how she got her start in this business and where she's headed these days. Welcome to the show, Dr. Vera.
Hi, Ken. Great to be with you again.
So, Dr. Vera, tell us a little bit about who you help and how you help people.
I help dentists, hygienists, and dental assistants to take higher-end continuing education to meet their continuing education requirements, usually every 2 to 3 years. And what I do is I stay as up-to-date as possible. So not only am I teaching, but behind the scene, I'm taking a lot of continuing ed myself so I can stay in the forefront of what's going on in sleep apnea and snoring, that world. Has anything changed with TMJ? Other subjects, like you mentioned, the oral manifestations of systemic diseases, oral pathology, what has changed, what's new. So that's what I'm trying to do now.
So this isn't where you started. You were a dentist long ago. Why don't you tell us a little bit about how you got your start in dentistry and industry in general and how that's progressed over time for you? I
was finishing my undergraduate degree in Louisville, Kentucky, in clinical laboratory sciences. So I was the person in the basement, not the basement, but the first floor of the hospital. And when you would have to have blood work done, sputum, stool, you name it, I was the person that got that sample, and I would run your blood work, the microscopy, etc. And as much as I loved it, what I loved more was when the surgeons would come and talk to us, and we got to work as a team, and then I got to hear about the patient. And so what I realized was I longed for direct patient contact. And so that really pushed me because the dental school was right next to the building where I was going and finishing my degree. So it was a pretty easy transition from finishing my internship, finishing my degree. I had the weekend off, and then I literally started dental school.
So you went through dental school and became a dentist. And were you in your own practice, or did you initially start with another more experienced dentist?
No, I did. I loved hospital medicine so much. I wanted back in the hospital. So I did a general practice residency at the Portland Veterans Hospital in Portland, Oregon, and I absolutely loved it. I got to do surgeries. I'm not talking just dental surgeries. I got to cut lung out of a human. I got to put chest tubes into a human. I got to put my hand into someone's chest and feel their beating heart. I got to help with ear, nose, and throat surgeries. I got to be in brain surgery. So my experience was so incredible, and I was very, very happy that I was in the hospital setting again, ordering tests, looking at more difficult cases, working with surgeons, working with physicians. And then I decided, okay, that was a year, then I'll look at buying a retiring dentist practice. And I did that, bought a retiring dentist practice. And that great opportunity, and there were a lot of older patients, which I really loved because at the VA, I had a lot of older patients, and they always had stories and a lot of wisdom to share with me. So when I got into private practice, it was similar to that, but I missed the complexity of very ill people, my patients that were coming in with brain tumors, they couldn't see well, things like that. And so I got bored really quickly in general practice. So a patient came in one day, and she wanted me to do veneers on her. And I looked at the way her teeth fit together, her bite, and I knew I'm not experienced enough to do her case. And she had been bulimic for many, many years, so that affected her teeth greatly. And I told her, I said, I don't have enough experience yet. I'm going to send you to my friend who has tremendous experience in cosmetic work. And so she went to him. And I called him and I said, hey, where do I go to learn what you did? And he said, you need to go here. And I went to this place called the Las Vegas Institute of Advanced Dental Studies. It's now called LVI Global. It's in Henderson, Nevada. And I spent a large sum of money there, and it was the best training I've ever had in my life, and I don't regret spending one penny there. I became so fascinated with the entire patient and the whole body again that I went on and I even did more orthodontic training as well. And so I've always been a big advocate of taking advanced continuing education and taking what's the best CE out there, what's on the forefront, what is cutting edge. And so that's hopefully what I'm kind of pushing my participants in my own business, my own courses that I'm doing now is I'm going to give you a great course, but I'm encouraging you to push yourself to become an exceptional practitioner.
So you've transitioned then from your dental practice now to being an educator and teaching continuing education courses to dentists.
Yes, and that was a really difficult transition because, I was 8 months into my private practice. Okay, I had borrowed all this money. I was the poor doctor with the old beat-up car. And 8 months into it, I remember the day I woke up and I couldn't turn my head. And it felt like someone had taken like a searing hot poker and was stabbing me in my neck. And I was like, uh-oh, okay, I can't lift my head up from the pillow. So, you get up, you have bills to pay, you have staff, you have employees. And I thought, just get up and go take a couple Tylenol, you'll be fine. That turned into taking a lot of Advil, maximum doses for 5 years, then taking another drug called Celebrex for another 2 years, and just really hanging on so that I didn't have so much neck pain and arm issues. And work on my patients. So I was still taking a lot of continuing ed, adding great equipment to my office. I had a laser like a lot of dentists do nowadays. I had a microscope that I worked with because I loved microscopy. It was a great transition. And unfortunately, my neck pain and my arm going numb, it just became so problematic. It was difficult for me to work. And I decided to sell my practice. And I had a period of about 3 years where I really felt like I had no identity. It was hard. It was very hard. But what I had forgotten was, hey, I was in a TMD study group every month. We would meet and talk about cases. This is in Oregon. And I thought, why aren't you still doing that? Why aren't you doing more of that? And my active release techniques doctor at the time said, you're so intuitive and good with touching tissue. Why aren't you doing your own manual therapies? And I thought, yeah, I've done manual therapy in the past for TMD. These are just more precise techniques. And so he encouraged me, and I went on to get certified in active release techniques for upper extremity. And then I started did private practice again for just doing TMD. Well, that led into when these patients aren't getting better, they still don't feel good. Something else is going on. Well, the something else was snoring heavily every night or full-blown sleep apnea. And so I also incorporated that into my practice as well.
And you're able to provide these treatments in an in-home setting, right? In other words, you don't have the standard office that you think of when you go to see a dentist or a TMJ provider. You actually have appointments where you go to people's homes and treat them in their home.
Absolutely. Because I have flexibility with my schedule and I can work on the weekends when people may not be as busy, I just bring my little carry case. I bring my things to you and evaluate you at home, and I'll treat you that day. It isn't, I'm going to come and look at you and you need this and this. No, I'm going to do my best to give you honest diagnosis. This is what I think is going on. Let's develop a treatment plan, but let's treat you right now to get you feeling better now.
I'm sure COVID's affected that business quite a bit. And in the meantime, I know you've been busy getting more education, more continuing education, and also expanding your teachings offerings. You also are an educator in the dental continuing education space. Tell us a little bit about your experience there.
Oh, yeah, absolutely. So how my life changed was I was taking a CE course because at the time I lived in California, and the company had a little handout that said, oh, would you like to teach a course? And I said, yes. And they called me and interviewed me, and I said, well, I could teach a number of subjects. So this company hired me, and it started with one class, Head and Neck Anatomy Review, which is my absolute favorite to teach. And it blossomed into a number of courses and a number of subjects, even ergonomics, et cetera. And I just decided I've done really well with that company, and I've been with them for over 10 years. And I thought, it's just time for me to kind of branch out and jump out of the nest and be on my own. So I'm going to do a few additional TMJ courses, sleep courses, and then to further push myself and, still be this exceptional practitioner is I'm looking to do a program with Dr. William Hang. He's in California, and it's facial orthotropics. Because the best thing I ever did in my practice, and yes, I did a lot of cosmetic cases. I did full mouth reconstruct cases. Patients looked better. It was life-changing. Absolutely it was. But what meant the most to me was when children came in and teenagers that were suffering from airway issues. And thank God I spent the money. I went to go get trained. I got introduced to these are what kids look like that have inflamed tonsils and adenoids. These are what kids look like that breathe through their mouth. This is how they develop. This is why their teeth are crooked. Those children then that came into my practice, and I would write a letter of findings. I'd talk to the parent. I would write a letter of my findings. Take this to your doctor. I want you to get an ENT referral. And many of those children went on and had their tonsils and adenoids removed, even my dental assistant's daughter. And then we're able to do interceptive ortho appliances to help redirect growth of the face, the development of the face. And we get these kids with these big, wide airways, big, beautiful mouths, straight teeth, of course, but the airway is the issue. We typically think of orthodontics as my kid has straight teeth. However, in my opinion, and it's one, the most important thing about orthodontics is the development of the face and the airway, and then we'll straighten the teeth at the end.
Are there any myths or misconceptions related to what you do?
Absolutely. And, one of the biggest, I think, myths of a dental practitioner, whether you're the assistant, the hygienist, or the doctor, is I graduated school. I don't need any more education. I'm going to take the bare minimum. This is just complete BS. And I would encourage everyone, first of all, you push yourself to be an exceptional practitioner. Don't be cheap. Take the big courses. Come back to work. Immediately implement what you've learned. Increase your fees and deliver, and you'll be fine. But this, well, I'm going to take, like the cheapest thing I can find, and that's all I'm going to do. I do some of that because the courses are really fun, and then they're easy and they're convenient. That's perfect. But some of the other subjects, I need more. I need 2 full days, etc. So I just want to encourage people to really push yourself to take the time, spend the money, and be a great provider.
So, Dr. Vera, you've changed a lot of people's lives. Can you share with our listeners maybe one story that really sticks out in your mind as someone that came to you that really needed your help, and your education and your talents and expertise really made a difference for them?
I'm going to give you 2, but I will keep them brief. One was in private practice, and a young man came in, and his father really didn't trust me for a number of years because I was so young when I bought this retiring dentist practice. This 14-year-old comes in, Dad came in with him, and he finally started warming up to me. And he looked at me, his dad looked at me, and he said, Vera, they put his son in this orthodontic appliance for the 3rd time. And I said, I wonder why. And I said, well, come back and let me have a look, And he came back, and I just said, open your mouth and, just stick your tongue out and say, let me have a peek. And what I saw was 2 tonsils that were almost kissing. So here's this young man who's 14, big, burly kid, breathing through his mouth, can't breathe through his nose. snoring at night, which I didn't know until I asked the dad, had just come from the orthodontist office to get this appliance put on for the third time. And I had his dad, I said, will you come back and let me show you what I think is going on? And Dad looked in his mouth and he said, his tonsils are huge. And I said, yeah. So he's breathing through his mouth, and the whole idea of the orthodontic appliance was to get his jaw to grow forward, nice, big, happy face. But he's restricting the growth because he's breathing through his mouth, and it's just a battle. And so I think that was probably one of the greatest things I did was, I took advanced classes, learned to look at the face, look at the tonsils, and go, there's a connection here. So I think that was one. Another one, and I could actually say it's like 3 or 4 or more, are dentists and hygienists that contact me after they've taken a continuing ed course with me. So this is with the company, or now me being on my own, and I teach them about their TMJ patients that come in with numbness of a finger. Maybe their arm feels numb. Maybe their arm feels heavy. Maybe they have some repetitive motion issue. And I have the dentist assistants or hygienists call me and go, that patient is me, and you just described me. And I help them find a practitioner in their area that I believe might be able to help them. And they call me back and go, God, thank you, because I can work again without pain.
Dr. Vera, I'd say you are the poster child for the phrase educator and advocate for your client's success, whether it's children, dental patients, other dentists and hygienists, or whatever be the case. You're always looking to help somebody and learn more. I've known you outside of the show here a bit, and one thing I can tell you folks is that Vera is an avid learner, nonstop learner, and loves to communicate what she learns to other people to spread her knowledge. Vera, thank you so much for being on the show. Tell our listeners how they might get in contact with you, whether they need some help with sleep apnea or an appliance or some of your services, but also for continuing education or more specialized conversations.
So let's start with the website. So if you're interested in any continuing education courses with me, the website is easyce.live. Okay, so that would be for the CE. And then if you want to call me directly, it might take me a couple of days to get back to you. But if you want to call me, please don't text. Call me like a normal person. My phone number is 480-489-7293. And then the email address is Vera, VERA, at easyce.live. So Vera, VERA, at easyce.live.
And Dr. Vera, I believe off air we were speaking about your 2-day program coming in 2022, where people actually fly into Arizona for a 2-day event at the Phoenician to learn all about sleep apnea and TMJ and TMD. How's the progress on that going?
The progress on that is great. A little bit slow, but we have time because that's next year. But I want to be able to show people here's another way to look at your patients. Here's a way to look at your TMD patients, not just, I rub a muscle here and there, and we'll just make you a night guard. It's more than that. We want full body, full patient awareness. What's going on with their labs? What's going on with their diet? How is this working with sleep apnea or their snoring?
Well, Dr. Vera, thanks so much for being on the show today. I know you are always running one direction or another between all of the different businesses. And by the way, why don't you tell the listeners also a little bit about what you do in your spare time?
Oh, in my spare time, I like to tell people I play as hard as I work. So in my spare time, I do Brazilian Jiu-Jitsu. I compete. I've won 2 Masters World Championships in Brazilian Jiu-Jitsu. Do a little judo. I like to cycle a little bit when it's not too hot in Phoenix. I love to hike. Anything that I can be outdoors. I love to swim, so I swim a couple of days a week. So I'm very, very active. And here's the one thing. I do get asked this quite often, which is, well, Vera, like if your neck, you have such a bad neck injury and your arm doesn't work the same, how do you do all this stuff? And I just look at them and I point to my mind and I go, I have a very strong mind, and I'm not going to sit in a corner and suck my thumb and feel sorry for myself.
And that's why you're the perfect guest for the show, someone that competes and lives at the highest level. Thank you so much for being on the show, Dr. Vera. Really appreciate your time today.
Thank you, Ken.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.